And basically the patient goes around without a knee or a hip for 3 months. The infection rate in knee and hip replacements has been 2% for pretty much forever. It hasn't changed very much. And infections in joint replacements are truly disastrous. So that is a cause for a revision, because if you don't get the metal out, the bacteria hide on the metal. They're not affected by antibiotics. Don't permeate metal, so the bacteria stay on the metal, and they actually can stay on there forever.
So it's disastrous in those areas simply because you can't access it to eliminate it.
Well, you can eliminate it, but you have to take the prosthesis out.
Oh,
And you take it out, and then you put in sort of we call it a spacer. They make molds where you can take bone cement and you fill it full of antibiotics, and you kind of stick it on both surfaces, and basically the patient goes around without a knee or a hip for 3 months. And then you go back and do it again, assuming everything is
healed. Yeah.
I had a patient once that had an infected hip replacement and had the other hip done shortly thereafter, not in Portland. It was done in, I think it was Pennsylvania, and he came in to see me for his first visit, and one of his hips was infected.
Yeah.
And we took it out, we did everything, and we put it back in, and we kept him on antibiotics for the rest of his life because of the very great likelihood that the one that was already in first, that didn't obviously show an infection, probably had one bacteria hanging around. So,
well, you talk about these complications, and from other patients coming in from other surgery stuff. Have you ever had a situation where a patient had been dismissed, but because you're being social with them and connected with them emotionally, you ended up discovering something that, like a complication that had been missed as well?
unfortunately, yes.
Can you tell me more about one of those?
Probably one of the more memorable ones was a patient of mine who was involved in a motor vehicle crash, and she broke her hip in the motor vehicle crash.
Okay. Age?
Probably 35.
Okay.
At the time. And she was an interior designer, had her own business. And of course, she didn't have any business while she was recovering from her hip replacement or her hip surgery, which was they repaired the bone.
Yeah.
And she had seen an out-of-network physician.
Okay.
And in those days, I really wasn't very savvy about charges with out-of-network physicians, but all that was really not important. But what was important is that if I do surgery on you, I see you for 3 months as part of a global package. You don't have to pay me for 3 months to come and see me. If I have to get an x-ray, when you broke your hand, if I had to get an x-ray in the healing, you can charge for the x-ray, but I can't charge you for an office visit for 90 days.
Okay.
So in this woman's case,
considered part of the service.
It's called the global package.
Okay.
And not all surgeries have that. If dermatologists do a lot of stuff that has 10 days is all that's included, because dermatologic problems come back and back and back. There's a problem. But in this case, the fixation of her hip.
What's the fixation?
Well, it was a plate on her femur that then also held the upper part together.
Oh, the bone, the broken bone.
The broken bone, right. And at 90 days, and she was having troubles, at 90 days, the doctor said, well, I'm not on your health plan. You have to go find a new doctor.
Just washed his hands of it.
Yep. And redoing what she had was challenging at best.